Banner Health has created a new role called Alzheimer's Equity Navigator. And here to tell us about the program is Serena Lowry and Dr. Nadia Morley. And, you know, we were talking before we came on that this is something that's very important to be talked about, especially in communities of color, because it is ignored, it's embarrassed to talk about, or better yet, don't know the resources. And that's why this program is so important, to help those communities find the resources that are pretty much right down the street from them. They might know about it, or where they're available for them.
Right. So what my main job is as the Alzheimer's Equity Navigator is to go into these diverse communities and help navigate them through the memory loss or dementia, with connecting them with, you know, community resources, caregiver support, and also clinical trials like research.
Yeah. Let's talk about the free Bring Health check-in, because that's so important right there, isn't it?
Yes. So we have a program in which we do a quick checkup. So basically, it's similar to going to your primary care provider and just getting your vitals done to see if everything's okay. So you will come into our office, and then we will do a series of questions where we'll test your memory, your language, and various things. And then we'll let you know, okay, everything seems like it's okay, or we have some concerns. And so that is offered free to the community.
I like it. Let's talk about the prevention clinic trials that you have going on, which is so important to not just the community of color, but every community is important with this too.
Exactly.
So with the prevention trials, what we have seen, so Alzheimer's research started in like the 1970s, and up to now we have not found a cure. However, we have found that you can do certain lifestyle changes and implement certain things earlier so that you can reduce your risk. The damage starts about 20 years before symptoms, and so we're trying to get people in as early as possible. The program, the AHEAD study, starts at age 55, where we will try to work with individuals to say, are you at risk? We'll do a simple blood test. We'll do an extensive interview to find out what your risk factors are, and go from there to see if you would qualify for the study. And if you're under 55, there is another program that Serena will tell you about.
So that's the, we have a website. It's called Alzheimer's, it's called NALZ now.org /equity. And that program is you go online and you register. You put in your information, which is very quick, simple, easy to navigate through. And if you're eligible for any of our research studies, that we will give you a call, and you can participate that way.
Wow, that's important. I know we have some slides here. I think I don't know if they popped them up, but let's pop them up really quick. Our first one here. Let's talk about this here. This is something that's very important here, right?
Yes. So the research shows that that minorities are, so African Americans 2 times more likely, Latinos 1.5 times more likely to develop dementia. I could go on for hours about the reasons why, but the fact is, we are more likely, and so we are trying to catch people earlier, which is why these pharmaceutical companies are trying to step into the diversity realm and find innovative ways, for example, Serena's role, to get people more involved, to go out into communities and let them know that, hey, this is what's going on. It's in your community. We cannot ignore it anymore. Right. Here are the resources you need to overcome this.
To do it, yeah. And then the second slide here is also talking about, of course, numbers again.
Yes, yes. So as you can see, African Americans, the prevalence of Alzheimer's disease in ages 65 plus, African Americans 18.6, which is even higher than their census. Hispanics 14%, Caucasians 10%, and then Asian Americans were 8.4%. So pretty high numbers there.
So, and again, this is where you want to get people connected, and that's where Banner Health wants to, and also the prevention. I think the big part is, I think we say, is that check in on mom and dad, check in on yourself, and don't ignore some of the signs as just going through, oh, I'm getting old, or that's just mom, or that's dad, or anything. Dad always gets lost, stuff like that. That's not something we should be doing anymore, is it?
No, we should be open and honest and talk about, you know, if we see something with our parents and our loved ones that is not quite to the norm, they're forgetting ingredients for recipes or something like that, we need to, you know, check our brains out like we check our bodies out. Go in and get your primary care doctors. I connect myself with primary care doctors within Banner, community health centers which are outside of Banner, and a lot of resources like Benevilla support groups, programs like that to keep your brain active and keep the individual active. Because also, what we noticed during the pandemic, the isolation was detrimental to a lot of people who were affected with Alzheimer's disease. So we want to make sure that now everyone knows about this, and in the diverse population more so, because the education is not getting in there. So that is my job, to make sure I can help navigate them through.
I like that. So let people know where they can, of course, find information about what we've talked about, and of course, getting the support they need.
So
Oh, sorry. Real quick, dementia is not a normal part of aging. So if anything else from this segment, people need to realize that forgetfulness, any type of major brain changes, that's not normal. So get yourself checked out if you're noticing signs.
I like that. No, that's great to know. I mean, because again, it doesn't, it has no age limit, is what it is. So,
Exactly.
I love it.
Exactly.
So, and we have information actually on the screen there where we can find out where you can get connected and stuff, and we'll have it on aztv.com also. So,
Okay, thank
thank you,
you.
ladies. Thank you.
you.